I'm gonna knock, enter my patient's room. Hi, my name's Brooke. I'm gonna be your nurse today. I have an order, your doctor has an order put in for some Zofran for your nausea, so I'm gonna go ahead and give that to you. Do you have any allergies? Okay, can you tell me your name and date of birth? And I'm gonna verify their name and date of birth on the wristband. They said they don't have any allergies, so we're good there. I'm gonna provide for privacy and wash my hands. So before coming in the room, I prepared my medication. I checked it 3 times, once against the orders in the medication room, whenever I was pulling the medication, and then at the bedside before I give it. I'm just checking my medication to make sure that it doesn't need to be diluted before given, that it is compatible with what is running through their IV, if anything, and the safe dose range for it, the rate that I would be pushing that medication, and any adverse effects of it. Make sure that it's going to have a therapeutic effect. My patient's not allergic to it. Yeah, so I've already prepared it, and I've used the 6 rights of medication administration: right patient, right medication, right dose, right route, right time, and the right documentation. So I'm going to assess my patient's IV sites for any complications, infiltration, or inflammation. I'm also going to ask my patient, make sure they're comfortable and that it's not bothering them. Everything looks good, so I'm just going to clamp off their medication that's running, or if it was on a pump, I would pause the pump. And then I'm going to wash my hands and put on gloves. And I've gathered all my supplies. So I have a flush, the medication, and verified again that that is the right medication, the right patient, and all that. So I'm going to take an alcohol swab, and I'm going to use the port closest to the patient, and I'm just going to wipe that off. And then I'm going to take a flush. I'm going to pull back to make sure I get blood return, and then push my flush. Once I have my IV flush, I'm going to take another swab and just wipe off the port again. And then I'm going to take my medication. I'm going to push that slowly, or at the rate that it is recommended to be pushed. Okay. And then I'm going to take another alcohol swab and wipe that off again. And I'm going to take another flush, a separate flush, and attach that to the port and flush my patient's IV the rest of the way. Then I'm going to take another swab and just make sure that it's nice and clean. And then I'm going to take a Caro's cap and attach that to that port. I'm going to make sure, I'm going to clean up my area, and then I'm going to ask the patient how they feel. I'm going to make sure that they haven't had any adverse reactions from that medication. I'm going to document the time that I gave the medication, what it was, the rate that I gave it, and that they had no reaction from it. I'm also going to document that the IV site looked good and there wasn't any infiltration or inflammation or any other complications. And then I'm just going to unclamp my primary tubing that was running beforehand, or I would restart the pump if it was running through a pump. I'm just going to take off my gloves, perform hand hygiene again, come back to my patient, make sure they're okay, they don't need anything, they have their call light, their bed is low and locked, they're comfortable, and have no complaints at this time.